and 49 additional COVID-positive patients have died. Of course, we'll walk through all these numbers in detail here in just a minute, but before we do that, I want to emphasize that the number of admissions and the number total patients, whether we are a few patients up or a few patients down on any given day, is still dangerously high. Until we reduce these numbers significantly, our hospitals will be in a very precarious situation. The amount of virus spreading in our community is still putting us all at risk. We are still at the height of the pandemic, so don't let anybody tell you otherwise. So let's take a look at where our numbers are today. And as always, we start with our graph highlighting our regional hospital admission data. The numbers, although softening a bit recently, have jumped back up into some scary territory. Our daily admission number, which again is lagged by 2 days, today we're reporting is 131. Our 7-day rolling average continues to be very high as well, and the average now is at 117 new daily admissions. In addition, today we're reporting 871 persons hospitalized with confirmed COVID in our hospitals. So just to put this into a little bit of perspective, we broke that 800 patient mark back in November, on November 16th, and have not come down below 800 since then. Our moving average now is at 867. A little bit more detail on our hospitalization numbers, and again, these are COVID positive patients only. Today we're reporting 871 patients within our hospitals. We have 182 patients in our intensive care units, and we have 114 confirmed COVID positive patients on our ventilators today. Now let's look at our suspected COVID positive patients. And again, these are patients where we're waiting for a test result to come back. Today we're reporting 75 people hospitalized with suspected COVID. We have 11 suspected COVID patients in our intensive care units, and we have 7 suspected COVID patients on ventilators today. Looking at our good news slide, which is again our discharge slide since April, we've discharged 13,715 patients from our task force hospitals. And a total of 140 patients were discharged yesterday. Again, very high number, but we have high numbers within our hospitals, so this is to be seen. Moving on to our unfortunate news today. Today we're reporting 31 new daily COVID deaths, the highest daily number that we have reported since we began sharing this data. And this has moved our 7-day moving average up to 18 COVID deaths per day now. And again, this graph highlighting how cases, admissions, hospitalizations, and deaths all track. So the key to reducing all of these is to reduce the cases out in the community. Going through our report card here today, we're showing around 20% of our hospital beds are occupied by either a COVID patient or by a patient under investigation for COVID. So again, it's within our orange area, but just below the red area. We are above that red line when it comes to intensive care unit capacity. We're reporting around 27% of our ICUs have a COVID or a patient under investigation today. We spoke about this briefly a little bit earlier, still seeing a very high level of COVID admissions into our task force hospitals on a daily basis. And you saw that number that I reported earlier at 131 today. So still a very high number of patients being admitted to our hospitals every day with COVID. Looking at our prevalence of cases, this has dropped a little bit over the past couple of days, which is good. You remember where we were at around 11 about a week and a half ago, and now we're around 9. So again, the way to think of this is around 1 person out of every 100 has COVID out in the community right now. Our weekly change in reported cases has dropped down again. So again, this is comparing a previous week with the immediately following week. And so if there's a difference in cases there, then it'll bring that percentage down, which is good news. We'll have to continue tracking the case rate to see what that does, but this is good news. Our positivity rate, though, is still very high. It's hovering around 20%. That is our task force hospital diagnostic rate for testing. Now, this will ebb and flow, but overall, it's around 20%. But again, extremely high. We would want that to be down around that 5% mark before we'd feel comfortable with saying that we've adequately suppressed the virus. So still, large number of people are coming back testing positive for COVID-19. And our reproductive number that you hear us talk about quite a bit, again, we want to keep this below 1. Ideally, we would want to keep it substantially below 1. Right now, we're reporting around a 0.94 across the metropolitan area. Now, remember, we still have a lot of virus out in the community, so a high prevalence out in the community. So we're still going to see those patients show up in the hospital unless we can really get this transmission rate down. And the way to do that is by doing all of the things that we've talked about for, it seems like, all of 2020, which is wearing a mask, social distancing, not gathering in crowds. So as you can see in today's numbers, we're still very much in crisis mode. You know, wars don't stop for the holidays, and our war is no different. Our brave and courageous healthcare workers, public health workers, EMS workers will continue to battle over the holidays and every day until we get to immunity. COVID-19 is a brutal, deadly, highly transmissible disease, and if we give it the opportunity, it will continue to spread through our communities and claim more lives. And that is why I must ask you again to please stay safe as you celebrate this Christmas holiday. Celebrate at home, celebrate with people you live with, and do everything you can to keep yourself and the people you love from winding up in the hospital with this virus. We have learned what we need to do to stop the spread. Wear a mask, wash your hands, stay 6 feet apart, and stay home, especially if you're not feeling well. Now, this is not the time to let our guard down. These steps can't stop because of the holiday. If anything, they're even more important now. Christmas 2020 is not what any of us planned at the start of the year. None of us want to be stuck at home. None of the patients in the hospital plan to be there either. And none of those who have lost loved ones to this virus want to be without them this Christmas either. But this is the Christmas that we have. We can't make it what we dreamed of, but we can make the next several weeks much better. If we take these proven steps to prevent the spread of the virus, we can get through this war faster and with fewer losses. We can make Christmas 2020 a little easier for others. So this week, please remember those who have lost friends and loved ones in this war, and keep those that take care of us when we do get sick in your thoughts. Call or text someone you know who is missing someone dear. Do what you can to lighten their load. Reach out to someone who is sick with the virus or stuck in isolation. Tell a healthcare professional or first responder you appreciate all that they're doing. You might be stuck at home, but you can still touch someone's life at a time when they might need it the most. And above all else, everybody have a Merry Christmas and a happy holiday. And with that, we'll take some questions from the media. And apologize for the phone ringing.
What does capacity look like for the regular hospital beds and ICU beds today? And what does that mean for how hospitals will have to proceed if there is a surge in cases after the holiday?
Yeah, so as we mentioned in our percentages, we're sitting at around 30% for our intensive care units and around 20%, a little bit below 20% for our regular hospital beds. Now that varies from system to system and hospital to hospital, so obviously there are some that are more full than others. What I can tell you is when I checked our SSM numbers earlier today, we were sitting around 92% capacity for our intensive care unit and around high 80s across the board for all of our beds. And I think most of the hospital systems, when we spoke on Tuesday, were in that same ballpark. And so the reason why I mention that is, we're still in a very delicate situation right now. Our hospitals are still extremely full. This is not usual business for us. Now, just like any other organization, we've learned to adapt to take care of everybody and to do the best that we can with the patients coming in. But it's certainly not ideal. We're still at elevated levels within all of our hospitals. We still have very little room to maneuver if we did see a surge in cases. And so we're not out of this by any stretch. And any increase in patients that we'll see is going to throw us back into that crisis mode.
We are seeing spiraling numbers in California and hearing discussions there of crisis care protocols.
Mm-hmm.
How far away are we from similar scenarios here in this region?
Well, as I mentioned before, we're still very full. Now, we have come down a little bit from that peak of a couple of weeks ago when we were on a really exponential growth phase. And so we're sitting at around 870 COVID patients right now across all of our hospitals, and around 180, 185 in our intensive care units. Now, at our peak, we were around 950 and around 200 in our intensive care units, and that was when we were very although we have a little bit of buffer space, it's still not much. And so if we saw a dramatic increase in the number of cases, pushing those numbers that we had seen before, that would then get us closer to a tipping point into that crisis standards of care. There's no hard and fast number that you put on it, but it is discussions, and we're still planning in case we reach those numbers. Granted, we have a little bit more time now, but those numbers from a couple of weeks ago were really scary, and we were afraid that we were going to have to move in that direction. But we'll continue to plan.
County Executive Sam Page has said now that he will allow limited indoor dining to resume if cases remain stable. Is this something that is realistic and/or safe?
Well, I think we'll have to keep our eye on the data. So, as the CDC has mentioned, there was an article that came out in, I believe it was Nature a week ago. Restaurants are still high-risk areas where people can contract the virus. And so I think we're going to have to follow the case data, follow the hospitalization data before we make that decision, before Sam Page makes that decision. If we continue to trend downwards, consistently trend downwards, and I'm not sure what other mitigation strategies they're going to put into place with the restaurants. And so it's a combination of things that you really want to have a good look at to understand whether this is going to be safe or not. So I think there's still some things that we're going to have to take a look at.
That concludes the list of questions we've received from members of the media prior to today's briefing. Thanks for watching.